Welcome to this week's Association Chat podcast, where we warm ourselves by the virtual fire, recorded live and streaming out to you, covering the topics of the day with thought leaders and trailblazers alike in this online home for the community. I'm the host of Association Chat, KiKi L'Italien, and on this episode, we're talking about the virus that just won't go away, COVID-19, and what one hospital association is doing about it. It seems like it was just weeks ago when many of us were beginning to attend in-person conferences. We were meeting again and talking about a post-COVID world. What happened? The latest surge, the Delta variant, hitting many communities harder than the Alpha version of the virus, has association leaders scrambling. We are once again talking with our meeting planners who are switching gears, and many of us are wondering, what happens next? The situation looks grim. In fact, 4 states, Louisiana, Florida, Mississippi, and Hawaii, have reported more coronavirus cases in the past week than in any other 7-day period. And in the thick of this latest surge is Safety Net Hospital Alliance of Florida's CEO, Justin Sr. Justin, thank you for joining us today.
Thank you for having me.
All right. So where to even begin? You know, things keep changing so quickly, and it seems like every time I turn on the news, there's more bad news. There's the numbers keep increasing. And so can you catch us up to where things stand right now? What's happening in Florida right now?
So we have 14 member systems, between 30 and 35 total hospitals. Our systems are children's hospitals, academic medical centers, and public hospitals. And they run the gamut in Florida, for everywhere from Pensacola all the way down to Miami and everywhere in between. And we're in pretty much every major metropolitan area. What we're seeing from tip to toe is that there has been an increase in the number of COVID patients, a significant increase over the last 5 weeks. That increase has put a lot of pressure on staff and has put a premium on the communication that our hospitals have with each other, as well as with their local and with state emergency management officials.
I mean, and that's been something that, you know, I think it's hard for us. A lot of us are, we're preparing for our children to either go back to school, or we're watching as I have friends who have children who are actually attending their first days of school this week. Yeah. And so I know that nerves have been sort of rattled as we're looking at this, not just as association executives and, but we're looking at it as parents, as humans who have been going through this process. What has the Safety Net Hospital Alliance of Florida been doing this whole time during this terrible surge?
Well, ultimately, there's just been a lot of communication about the numbers. It started first in the Jacksonville area, and the Jacksonville area, I think, remains a significant hotspot. But all of our members communicate on a regular basis what's going on, and there was a kind of a warning call went out that there were a large number of cases showing up in Northeast Florida. That was followed by big spikes in the Orlando area, and then another spike down in the Miami-Dade Broward line, which has been a hotspot in all 3 waves. And so everyone, really the primary issue that all of our hospitals have been dealing with is how to keep their staff motivated, how not to overtax or overtire their staff to make sure that they can get the best results. It's very interesting in terms of looking how this particular wave is the same as the others, but also in how it's different. It's a very large wave, but unlike in the previous waves, we've not necessarily been short on supplies. So the PPE shortages and some of the shortages on laboratory testing equipment like reagents that we were seeing last year, we're not seeing this year. Because the staff is largely vaccinated, the frontline physicians are well over 90% vaccinated, and the frontline nurses probably between 50 and 70%. So maybe there's a little work there, but there's a lot of them that are vaccinated. Mm-hmm. Last year, what would happen in the middle of this is that the nursing staff, you use all of these infection control protocols for the doctors and the nurses. But if it's spreading in the community, when they go home and they go out in the community to do their shopping, to hang out with their kids, they catch it. They come in the morning, they tested positive. They were getting knocked offline, which really put stress on staff because you had a hospital, Jackson, Memorial in Miami was a great example. 1,600 licensed beds roughly. They could staff all 1,600. Suddenly, hundreds of their staff members started getting knocked offline. They could only staff 1,500 beds, then 1,400, then 1,300. Meanwhile, their census was creeping up to that number, and it really put an emphasis for them on trying to get additional staffing resources from around the country and through the emergency management officials at the state of Florida. This time around, they're definitely seeing some infections in their staff and occasional breakthrough infections, but they're not getting their own staff knocked offline as much. The other thing that's a little bit different this time in terms of communication is this population that has it now, what you can see is that the vaccines are really working. So the population in Florida that's 65 and older is approaching 90% vaccination rate. I mean, it's really highly vaccinated. That population has kind of been pulled to safety. And we're seeing a lot of people in their 40s and their 50s now, which have a higher rate of no vaccine. Those are the populations that are showing up. There's a silver lining to that. That population is actually quite a bit easier to discharge. When you're dealing with patients in their 80s that perhaps reside in a nursing home, you can't even after they no longer need to be an inpatient, you could discharge them. You couldn't discharge them back to their nursing facility because they were still testing positive for COVID, and you had to figure out a way to try to get them out of the hospital so that the bed, your bed numbers wouldn't start getting backed up. But at the same time, you couldn't send them back to where they normally live. So the state last year and the hospitals had to work really hard together logistically to come up with COVID-only locations where they could safely send those patients where they could sort of convalesce and recover until they no longer tested positive and could safely go back to their nursing facility or assisted living facility. This time around, when it's someone in their 40s or 50s, they're a little bit easier to discharge. So you can send them home when they no longer need to be there. So there's some logistics here that are a little bit easier to deal with. When it comes to communication now, everyone is really just watching their supplies really closely. And again, it comes down to communication. There are plenty of ventilators, regardless of what you may have seen in the papers.
I was going to ask you about that. Right.
I have no equipment shortages, no supply shortages that any of my members are telling me about. But there's some logistical challenges right now to some of the deliveries associated with that. And oddly enough, when it comes to delivering some of the supplies and things like that, what we're seeing are some of the national phenomenon, like a shortage of commercial driver's license truck drivers.
Wow.
With the ability to it's not even an hours issue. Some of it, things like oxygen require very specialized licenses and a lot of precautions around it. And getting those drivers can be very difficult. So what we're seeing is everybody has to kind of factor in that maybe some of their deliveries are going to be a little bit more sporadic. So they need to make sure they've got plenty of supplies on hand in the event there are any disruptions. So that communicating about that, being ready for that, being prepared for that, letting state officials know if you've got a problem, that's the key here. And I know we had one of our hospitals last week. They called the emergency management folks about an oxygen issue. They said, listen, we need an oxygen delivery sometime this week or by the end of the week, there's going to be a problem. The state of Florida had state troopers bring an escort of oxygen trucks down to make sure that there were no problems. And that's the type of thing you've got to think ahead on to make sure you don't run short of anything.
Well, and so because this audience, it's full of people who are probably wanting to know how you're grappling with the communications and organizing some of this stuff and bringing these communications in. And then there are other people who are thinking about the meetings and the business and all of the, a lot of people who have their meetings in Florida and are wondering about what the future is with that. In fact, I see Simon over here. Simon, I'm not ignoring you. I saw your question come in. Simon asked, I believe what's going to happen is that all venues, hotels are going to mandate vaccines or ask for proof of negative tests. What's your opinion? I don't know if you were prepared to try to share your opinion on that, but Justin?
We've definitely had some businesses that have started to either mandate or strongly incentivize people to get the vaccine. I think Disney is moved in that direction. I think Publix supermarkets here in Florida has moved in that direction. And I think you're going to see more and more of that. I can tell you from a hospital perspective, it's actually not unusual for a hospital to mandate vaccines. They mandate vaccines all the time for other conditions because hospitals, one of the big things that they do is they're in the business of infection control. Every time you've been in any significant size hospital, guaranteed you've been in there with someone who has pneumonia, or there's someone in the building who has influenza or some other contagious disease. You didn't walk out of there with it. And that's because everything the hospital does, from the ventilation system to even the metal alloys used in the fixtures, is designed to prevent infections from spreading. So, vaccination protocols are part of the infection control process of the hospital. I think you're seeing hospitals move in that direction. Oddly enough, right now, a lot of the hospitals in the state of Florida don't have vaccine mandates. And part of it is that they're going to probably do it a little bit later in the year after this wave calms down. Because if anybody's had the vaccine, maybe the first or second dose can kind of make you sick. And you don't want to make your staff sick for even a day or day and a half, because it's usually not long, but you don't want to knock your staff offline voluntarily. So they're trying to be very thoughtful about how and when they ask for these vaccines. And I think a lot of them are planning on doing it around November, when they have vaccine drives around a lot of their other vaccine requirements.
What I really appreciated you sharing earlier was some of the silver lining, because we hear a lot of the gloom and doom, and there is a lot of gloom and doom that's connected with some of the statistics we've been seeing and the news we've been seeing. What are some of the hurdles that you've seen this time around that are causing some of the problems that you see that you need to overcome versus maybe what was there before? Maybe they're the same hurdles. I don't know.
Well, I mean, again, it's a significantly better situation when it comes to supplies. It's a significantly better situation when it comes to the immunity level of your staff due to the vaccine. So getting your own staff knocked offline isn't as big a problem. It really is, in terms of the things that people are worried about, it's a staffing issue, right? I mean, the one thing that people are most concerned about is wearing their staff out under circumstances where a process that used to be very simple, delivering food down a hallway to each of the patients in the rooms down the hallway, used to take 10 minutes. Now that same person is donning and doffing personal protective equipment between every room as part of the infection control process. And something that used to take 10 or 15 minutes now takes an hour or two, right? Wow. I mean, so changing your processes, your intake process to make sure that you test people and you can identify who's COVID positive, get them into an airborne infection isolation room if that's where they need to be, get them to the appropriate spot. That all of those processes have had to be changed and reworked. Fortunately, this is actually our third rodeo at this point, right? So a lot of those
we don't like these rodeos, right, Justin? I mean, it'd be nice if we didn't have to do any of these again.
Yeah, this one is a surprising one, I can tell you. I mean, when you talk about silver linings, it's definitely an unvaccinated population. I saw a headline around Pfizer. Maybe Pfizer the Delta variant does more likely infect them. They're not ending up at the hospital. I can tell you it's still highly protective against hospitalization because we have a single-digit percentage of our patients are vaccinated. And I can tell you one thing that they don't talk about much at the federal level or nationally is a huge percentage of our vaccinated patients are transplant patients. So, and so we end up in our hospitals, because we do a lot of the transplants in the state of Florida, we've ended up with a little bit higher vaccinated patient load than some of the other hospitals. But taking those immunosuppressant drugs and really suppressing your immune system does leave those patients vulnerable, and it's something to watch for. I can tell you, no matter what they say about Pfizer and the Delta infection, it is highly protective, as is Johnson & Johnson and as is Moderna.
I mean, that's good to hear. I personally had the Pfizer, so
Yeah, I'm a Pfizer guy too. I read the headline. Uh-oh. Yeah, my whole family's a Pfizer family. So.
Right, a Pfizer family. Who knew that we were going? Yeah, my family is too. Switching gears here a little bit, I want to move into a leadership question. As an association leader, communications right now, they have to seem challenging. It's been said that the key to success in any sort of long-term program is that you have good communications. How have you approached communications with your board and with volunteer leaders during this time?
The one thing that we don't have is a lot of formality in our organization. As we've dealt with these different waves together, ultimately everybody is now, there's group texting where people, the hospitals are sharing their numbers with each other, and we can communicate with each other right away. All of my members, I have 14 CEOs are my board, right? Of the 14 systems. And rarely a day would go by when I don't have a direct communication, either by text or by phone call, with at least one of them, and often more. And
Wow.
Ultimately getting an idea of what the lay of the land is in each of the various locations in our state, to understand the geographic differences. And it's a matter of communicating up, down, and out in every direction, right? To make sure that I'm talking to the board members, that the information that they give me gets to emergency management officials, gets to, the governor's office, gets to key legislators, making sure that I'm communicating to the people that report to me within my own organization if there's something that I need them to do. And everything is really flat and very quick. You've got to be nimble.
Yeah.
That's really it. Yeah.
I was just going to say, I mean, absolutely. I think that there's no time to sort of hem and haw when usually we joke and we say, well, no one's dying. I guess in this situation, yeah. I mean, actually, you are dealing with a very serious health issue, health issues facing.
And when you deal with an association, you often have people that are competitors that are in the same association. And so I do. Mount Sinai competes with Jackson Memorial down in Miami, and they all compete with Memorial right there on the Broward-Dade line in Hollywood, right?
Yeah.
But that kind of gets thrown out of the window in a crisis.
Well, and that's another question I wanted to ask you about, was on the sort of nuanced relationships between the people you collaborate with, the organizations you collaborate with, and partners. I can imagine that with so much focused attention on what's happening, on the moves that every organization is making right now, especially in healthcare, I can imagine that the tension is high, emotions are high, egos are high. How have you been sort of navigating that?
I think that a lot of it has been naturally put aside. I mean, it has been impressive, particularly in South Florida, which is a major healthcare battleground, right? Lots of turf wars between not just my members, but between Baptist, HCA, all of the various hospital groups. Everybody's down in Miami and in the Fort Lauderdale area battling out. It really has been impressive the way that all of the leadership teams at those hospitals have kind of dropped past grudges and tried to work together here. To try to get to the best results. And Baptist Hospital, which is not one of my members, has worked out an arrangement to kind of free up some of their capacity, where they send a lot of their non-COVID pediatric patients to Nicholas Children's Hospital, which is our member, to free up capacity. And those types of partnerships and those types of just sort of informal arrangements or formal arrangements have come to fruition. And I think that it actually has improved a lot of the relationships in the industry. We get into all these battles when it comes to the Florida legislature, or when it comes to national issues where we have different interests and fighting for different things. But it has been impressive the way people have been able to put that aside and try to get the best result for the people of the state of Florida. And I have to say, our hospitals have been in the front line every step of the way of this thing. When it started out, we have this kind of sophisticated laboratories, which were the only types of laboratories you could use early on to get a quick result as to whether someone had COVID or not. And so we were a very integral part of the testing early on. Our hospitals, because they're academic medical centers, they were doing a lot of the clinical trials around Regeneron and other things that turned out to be the therapeutics that we're using now. So they were part of the process of getting those things approved and testing them. And I can tell you one hospital in particular, they didn't know whether they were in the control group for Regeneron or not, but they realized that they hadn't had anybody pass away in an entire week when they started giving whatever they had been given. So, you could definitely see, it working, and they participate in that. And then we had the cold storage facilities to start distributing these vaccines. When it came out. So we have been at the forefront of all of this. And I have to say that the communication has been excellent, and we feel very proud of the staff, and what they've done under incredibly intense circumstances. Because if you had told someone that there was going to be a global pandemic in 2019, you said next year there's going to be a global pandemic and it's going to affect people that are 65 and over, you would never expect that Florida would have finished above the national average in fatalities per capita, in confirmed case fatality rate, and overall more fatalities during the course of the year. And yet Florida has. If you age adjust it, Florida's done really well. And our hospitals and the staff have been on the front lines of that, trying to advance the science, trying to improve the testing. and really working under very intense circumstances to get the absolute best results possible. And a lot of that logistical planning around discharges for the elderly last year were major difference makers in the state of Florida's results.
You know, what I really like about this conversation is that at a time when, you know, I'm watching conversations come together in the association community and in the meetings and hospitality communities, and we're all feeling really tense. We're really getting nervous about the surge and what it means around the country. And it is very serious, but you're giving us hints of light. You know, you're giving us some of the good stories that are coming out of the work that's being done, which I think is, I for one really appreciate. So can I ask, what's your big concern right now? I mean, now moving forward, looking ahead, what is weighing on you? What are you watching?
So, the things that you'd be concerned about that would really change the ball game would be if this suddenly had the same type of impact on pediatric patients that it does on adults. That is not the case yet, knock on wood. But if suddenly, we have 18 and under makes up maybe 20 to 25% of Florida's population. They make up barely 1% of the hospitalizations. And that's a good thing. We want to make sure that continues to happen and that those numbers stay extraordinarily low. But we're watching that and communicating that number every day, because if kids do start to end up disproportionately in the hospital, or frankly, even proportionately in the hospital, that would be a major change and an absolute game changer when it comes to school safety and things like that. So that's what we're watching. We're also watching the vaccinated numbers to make sure that those numbers also stay low. And then we're watching the overall number, with the biggest concern being wearing out staff. I mean, that's what you have to focus on, is your own staff's ability to handle the situation and to keep morale high so that you can get the best results. And so everybody is really watching that with bated breath. Nobody has any supply issues this time. It's entirely trying to make sure your staff has what they need and feels like they're being supported in doing their job.
So, association chat full of association people who are drawn to supporting the missions of, associations that represent every industry out there. Is there some way that people can help? What can people do? What can something that association chat audience can do to help you? How can they help?
The biggest help that anybody could do for any hospital right now is to go out and get vaccinated. And I think that, that's, if you're not vaccinated, it's to go out and get vaccinated. And I know I worry about some of the communication around that. I don't think that people that are worried about it should be bullied, that are concerned about the vaccines. I would say to that population, I know that this was a short turnaround in terms of the amount of time it took to approve these vaccines, but I think that people don't realize how long of a pause there is between each of the various stages of the approval process for all of these sort of up the line bureaucratic reviews of the data. And what I think has happened here is that those between stage time periods have been really compressed, and the people that would normally review the results of each stage sequentially have reviewed it concurrently. And that has really made the time period for approval compact. I also know that it naturally, if there's a 7 or 8 year approval process for a vaccine, you have an idea of what happens to the people who received the vaccine 7 or 8 years ago. Right. So we don't know exactly how long these vaccines last in terms of their durability. And I suppose in theory, it's possible that something might happen in 5 years or something to the people who've been vaccinated. To anyone who's worried about the long-term effects of the vaccine, I'd have to say that we don't know what the long-term effects of having COVID are either. Right? I mean, we just don't have enough time frame to know. So ultimately, I think it is the best choice. We can definitely see in the data that it's working. And I would encourage anybody that wants to, is engaging someone that's concerned about the vaccines, that's certainly, I think, the way that I would approach it, and say that it's really important. It really does help. We can't make any guarantees 5 years from now or 6 years from now, but if you have COVID, we can't make any guarantee either. And I think as we look at the contagiousness of these new variants, there may have been some people that were sitting on the sidelines thinking, maybe 50, 60% of the people get the vaccine, it starts to go away. I didn't get COVID, right. I don't have to get the vaccine, and I'm going to be fine. But I think that as we get into we get in a little further into it, we realize, you're probably either going to get COVID or you're going to have to get the vaccine. It really is one or the other.
Yeah, I have to say, I mean, that's the thing is what happens long term with any of this? We really don't know. And I do think that for the holdouts, I think there are probably a lot of people who were holding out who are saying, maybe it's time to move on. Look, I know we're at the end of our time. We have Facebook user who said, Justin, thank you and your organization for being there to support your members as they brave the front lines of this pandemic.
Thank you for being there, supporting our public hospitals and for supporting the various university-affiliated hospitals, state university-affiliated hospitals in the state of Florida. It's an honor to serve this organization and the hospitals that it represents.
Well, thank you so much for joining us today. I'm going to let you go. And, for all of you who are watching Association Chat, I hope that you got a lot out of this discussion. I know for me, I really appreciated hearing from Justin exactly, what are the positive things, what are the positive takeaways that we can take from something that is just really such a hard thing for us to be going through. And if you're feeling nervous, look for some of those signs of hope, signs of things going better. It's something that we can learn from and take moving forward. I really appreciate our time with Justin today. So thank you to Justin, and thanks to all of you for being a part of the Association Chat audience. If you'd like to support my work here on Association Chat, please visit patreon.com/associationchat and keep asking questions to learn every day. Because as Joseph Campbell once said, the cave you fear to enter holds the treasure you seek. Have a great rest of the week, everyone.